हे गाइस, वेलकम टू ग्रोमेड। इस वीडियो में हम पीडियाट्रिक्स वन लाइनर्स डिस्कस करेंगे जो एफएमजी एग्जाम में पूछे गए हैं। तो पीडियाट्रिक इज़ अ वेरी easy subject because questions are asked repeatedly on the same topics, and if you repeat the topics, read the repeated topics, then you can easily solve the questions. एंड ऑल्सो पीडियाट्रिक बहुत सारे सब्जेक्ट में कवर ऑलरेडी हो जाता है, जैसे कि अगर जीआईटी के डिसीजेज है तो दैट इज़ कवर्ड इन द सर्जरी, मेडिसिन, एंड अगर ईयर की है, नोज की है, देन दोज कंडीशंस आर कवर्ड इन द ईएनटी, और अगर आई की है, विटामिन डेफिशिएंसी है तो बायोकेमिस्ट्री में ऑलरेडी कवर हो जाती है। ठीक है, तो मूविंग ऑन विल स्टार्ट द डिस्कशन। पीडियाट्रिक में जो बहुत ज़्यादा ज़रूरी है टॉपिक जो पढ़ के जाना है, दैट इज़ द ग्रोथ पैरामीटर्स, डेवलपमेंट पैरामीटर्स, and the social milestones and the developmental milestones seen in the newborn. Or neonatology is also a very important topic. Questions are asked on the neonatology, resuscitation, then the jaundice, then neonatal sepsis. So all these topics you need to know from the pediatric. So the average weight of a newborn, Indian newborn, it is approximately 2.8 to 2.9 kg. Is the average weight. So questions are also asked if the weight is 2500 or less than 2500 or 2000. So we've discussed it in the video later. So usually one-liners are asked like the weight of the child doubles by what age, and it doubles by the 5 months, and the weight triples by itself by the age of 1 year. Then average height of a newborn approximately 50 centimeter. So question one-liners are asked height increased by 50% by what age? So it will increase by 1 year, and if you want to know the exact number, questions are asked on that also, like it will be 75 centimeter approximately. Then height increases by 100% or doubles by itself in 4 to 4.5 years. Recently asked one-liner. And the number is, it will increase by the 100 centimeter. Then questions are asked on the stature. What definition of the short stature? So it is the height less than 3rd percentile or less than 2 standard deviations. If the child falls below these categories, then we call it as a short stature. So there are two variants of the short stature, the familial and constitutional delay in the growth and the puberty. Questions are repeatedly asked on this, either as the one-liner or the case, clinical case of kind of questions. So let's see how do you identify them. So if they give in the question that the born age is equal to the chronological age, like the born age is 6 years and the exact age of the child is also 6 years, then that will be the familial, and also they will give the history of the short stature in the familial. And in the constitutional delay, the chronological age will be more than the born age. And the most common cause of short stature in India is the CDGP, and this is asked one-liner. Okay, then at what age does the chest circumference equal the head circumference? ठीक है, तो एक साल में at 1 year, when the baby becomes 1 year, then the chest circumference will be equal to the head circumference. So asked one-liner previous one. ठीक है, तो इंस्ट्रूमेंट यूज टू मेजर द मिड आर्म सर्कमफरेंस. तो मिड आर्म सर्कमफरेंस यूजुअली एक टेप से यूज करते हैं, कॉल्ड एज अ शकीर टेप. तो इस टेप पे ऐसे रहता है, एंड देयर इज सर्टेन फाइंडिंग्स, नंबर्स एंड कलर लाइक द रेड, येलो and the green. Then if it falls in the red, then it will be less than 11.5 centimeter, which will be suggestive of the malnutrition. And the normal will be between the 13.5 to 12.5. ठीक है, फिर next question, the instrument used to measure the skin fold thickness, and it is the hair pendant caliper. So image में इस question भी पूछा गया है इस पे hair pendant caliper पे. Then moving on, the first sign of sexual maturity in the girls. Frequently questions पूछे गए हैं इस पे sequence पे, sequence of the event. So you need to choose the right answer. Then moving on, the first sign of the sexual maturity. The puberty topic is also very important, as questions are asked in the correlation with the gynecology also. So let's see the first sign of sexual maturation in the girls. It is the thelarch. So the first sign is the thelarch, that is breast enlargement seen in the females, in the girls, and in the boys it is the testis enlargement. So let's see the sequence of the maturity. Frequently asked question. So girls में पहले event है thelarch, then after that puberty, which is the pelvis hair, then growth spurt and menarche. तो questions पूछे गए हैं कि in which phase growth spurt happens in the stage growth spurt happens in the girls, and it is the stage 3. ठीक है, then in boys the testis enlargement is seen first, then after that the penile length increases, not the width. So you need to look at it, because confuse करने के लिए question में दिए जाते हैं Then the third event, the tubak, and the last event is the growth spurt. ठीक है, then moving on to the primary dentation begins at what age? Begins at the 6 months and the first teeth to develop in the primary dentation is the lower central incisor. बहुत बार पूछा गया है one liner. Then in the secondary dentation it begins at the 6th year and the first teeth to develop is the first molar. So ये थी certain important one liners asked from the dentation. Dentation also a must be topic. ठीक है, then वेट से रिलेटेड कुछ प्रॉब्लम्स देख लेते हैं, जैसे कि लो वेट बर्थ. इफ द चाइल्ड इज लेस देन 2500 ग्राम देन इट इज कॉल्ड एज ए लो बर्थ वेट, एंड इफ इट इज लेस देन 1500 ग्राम देन वेरी लो बर्थ वेट, एंड लेस देन 1000 ग्राम देन कॉल्ड एज एक्सट्रीमली लो बर्थ वेट. यूजुअली वन लाइनर से पूछे गए हैं इससे कि मतलब अब न्यू बॉर्न बेबी उसका वेट इतना था तो ये किस में फॉल करेगा, किस कैटेगरी में ये फॉल करेगा. ठीक है, तो एज और वेट के हिसाब से आपको चूज़ करना पड़ेगा. देन लेट्स सी सर्टेन नॉर्मल फाइंडिंग सीन इन द न्यू बॉर्न. तो इसमें जो होता है ना हार्ट रेट, इट विल बी 110 to 160. इट इज कंसिडर्ड एज ए नॉर्मल हार्ट रेट बीट्स पर मिनट. ठीक है, देन द रेस्पिरेटरी रेट इनमें होता है 40 to 60 बीट्स पर मिनट. एंड द प्यूपिल रिपीटेडली आस्क्ड वन लाइनर, तो प्यूपिल जो है कंस्ट्रिक्टेड रहता है जब न्यू बॉर्न में. ठीक है, एट बर्थ द प्यूपिल इज कंस्ट्रिक्टेड. Then two very important topics from the pediatric are the cephal hematoma and the caput subsidenum. तो इनको देख लेते हैं. So if there is swelling present and it appears after the birth, 24 hours के बाद दिखता है and it do not cross the suture lines. अगर ये presentation दी गई है क्वेश्चन में, then the answer will be the cephal hematoma. cephal hematoma मतलब कि जो ब्लीडिंग होती है. ठीक है, और ये फिजियोलॉजिकल कंडीशन है, इसको नॉर्मल बोलते हैं और कोई इसके लिए एक्चुअली ट्रीटमेंट करते नहीं है क्योंकि ये खुद से चला जाता है. Then if the swelling is present at the birth and ये suture lines को क्रॉस कर रहा है, which crosses the suture line, then the answer is the caput subsidena. ठीक है, तो ये एक एडिमा है और ये भी फिजियोलॉजिकल है, नॉर्मल कंसिडर करते हैं और ये अपने से चला जाता है. So there is no required for the treatment in both the conditions. तो अभी नियोनाटोलॉजी से certain important one liners डिस्कस करते हैं. So questions are asked repeatedly on the neonatal resuscitation, and a classical famous question is when to start the chest compressions in the neonatal resuscitation. जब भी हार्ट रेट लेस देन 60 हो जाएगा देन वी विल स्टार्ट द चेस्ट कंप्रेशन. इफ इट इज मोर देन 60 देन वी विल डू द पॉजिटिव प्रेशर वेंटिलेशन और डू द CPR. इफ इट इज मोर देन and if the heart rate is more than 60 beats per minute then we will usually do the positive pressure ventilation and add the adrenaline. ठीक है, देन ऑल्सो क्वेश्चंस आर आस्क्ड लाइक क्लिनिकल केस की अगर बात करें तो इफ हार्ट रेट इज लेस देन 60 इवन आफ्टर द चेस्ट कंप्रेशंस तो हम क्या करेंगे, देन हम देते हैं एड्रेनालिन. ठीक है, और क्वेश्चंस ये भी दिए गए हैं कि रेशियो ऑफ द CPR इज टू द पॉजिटिव प्रेशर वेंटिलेशन एंड इट इज 3:2. ठीक है, फिर द मैक्सिमम टाइम टू पास द मेकोनियम इट इज द 48 hours. Then in the neonatal jaundice it becomes detectable at the serum bilirubin more than or equal to 5 gram%. Treatment of the neonatal jaundice, we will do it by the phototherapy and the exchange transfusion. ठीक है, then Apgar score also a must do topic. I will give you a 5 star कि Apgar score के सारे components आपको learn करके जाने पड़ेंगे along with the marks. Has 5 components: the appearance, the color, pink or blue, and then grimace, motor activity, respiratory effort, and the pulse rate. Then we will give the points 1 to 3, 0, 1 to 3, and the maximum score is the 10, and the minimum score is the 3. 3 is suggestive of severe asphyxia, and if it is more than 7, it is considered as a normal. Then moving on to the best way to prevent the neonatal sepsis, and it is the hand wash. The most important component of the surfactant. Surfactant must do topic. Surfactant से related सारे points you need to do it. क्योंकि फिजियोलॉजी और बायोकेमिस्ट्री में भी पूछे गए हैं इससे रिलेटेड क्वेश्चंस. एंड द आंसर इज द DTPC, ऑल्सो कॉल्ड एज द डेसिथिन. और इसकी डेफिशिएंसी में द चिल्ड्रन विद चाइल्ड विल बी हैविंग द रेस्पिरेटरी डिस्ट्रेस सिंड्रोम और द हाइलिंग मेम्ब्रेन डिसीज. And the classical question asked is for the prevention. How do we prevent it? Then we can give, if it is less than 34 weeks, we need to give antenatal steroids, the dexamethasone and the betamethasone. Then moving on, breast milk is deficient in vitamin K, vitamin D and vitamin B12. B12 strictly in the vegetarian mothers, and vitamin K and D. Vitamin K is most common, and you need to choose the vitamin K in the option if both vitamin K and D are given. Then moving on to the protein in the cow milk in composition to the human milk, and it is triple. Maximum height loss in the neonate is from the head. Then a decrease in the weight for height, it is called as the wasting. And decrease height for age, it is called as the stunting. Usually on the definition, the questions are asked, and this wasting, if the wasting is present, then we call it as acute malnutrition, and if it is stunting, then it is called as a chronic malnutrition. So questions are asked which parameter is used for the assessment of the acute and the chronic malnutrition. Then clinical feature for the diagnosis of the kwashiorkor, and it is the edema, a classical finding and a very important finding seen in the kwashiorkor. Then voracious appetite is seen in marasmus. And questions are also asked on the deficiency, like marasmus is due to calorie deficiency, and the kwashiorkor is mainly due to the protein deficiency. Okay. Then moving on to the next question, in severe disease, which foods to avoid? So you can remember it by the mnemonic BROW, that is the barley, rye, oats, and wheat. And what you can give is you can give the rice. Okay. Then one disease, enzyme deficient is glucose 6-phosphate, asked repeatedly and multiple times. And you need to remember all the enzyme deficiencies seen in the glycogen storage disorders. The most common cause of diarrhea in the pediatric age group, it is due to the rotavirus. Then zinc deficiency causes acrodermatitis enterotoxica, a very important topic. Image based questions are also asked, and biochemistry में भी इसके questions बहुत पूछे गए हैं. तो zinc deficiency a must do topic. Then moving on, Down syndrome also a must do topic. You need to remember all the points related to the Down syndrome के antenatal screening कैसे करेंगे, then what kind of features are seen antenatal on the ultrasound, then features of the Down syndrome. ठीक है, तो discussing the Down syndrome, one liner asked, and it is the trisomy 21. In components of the tetralogy of the phonate. So these are the components of the tetralogy of the phonate: the right ventricular hypertrophy overriding aorta, subpulmonic stenosis, and the ASD. So questions are asked, और सारे features दे देंगे, and which of the following is not a picture अगर accepted form में questions पूछे गए हैं. Then tetralogy of phonate on the chest X-ray seen as a boat-shaped heart, asked as an image-based question. Then moving on, most common cause of stridor in infants, and it is the laryngomalacia. It is due to the omega-shaped epiglottis, और conservatively हम patient को treat करेंगे. Then most common cause of common cold in infants, it is the rhinovirus. And the most common cause of the bronchiolitis, respiratory syncytial virus, multiple times asked as a one-liner. The most common cause of acute epiglottitis, streptococcus. And chest X-ray पे ये thumb sign दिखता है. This also asked as a one-liner, या फिर ये सारी findings देखिए, फिर ask you to make the diagnosis. ठीक है, clinical case kind of a question. Then most common cause of croup or laryngotracheal bronchitis, and it is the para-influenza. And on the chest X-ray, you can see the steeple sign. Also asked as a one-liner, you have to image this question. Then most common cause of hand, foot, mouth disease, and it is the Coxsackie A16. And the most common congenital infection, it is the cytomegalovirus. And the other infection are like the rubella. तो इसके triad है, which presents as the species A, patent ductus arteriosus, along with the sensorineural hearing loss, and there will be cataract. Asked multiple times, a clinical as a clinical case. ठीक है. Then, so now we'll see certain developmental milestones which are asked as a one-liner. So first, primitive neonatal reflex to occur, and it is the palmar reflex, occurs at 28 weeks in the intrauterine life. So there are other various neonatal reflexes which you need to know, like the parachute reflex, then asymmetric tonic neck reflex, symmetric tonic neck reflex, when they appear and when they disappear. Then rooting reflex appears at 32 weeks. The social smile develops at 2 months of age, and child can sit with support by 5 months. ठीक है. The child can stand without support at 1 year, and child can draw circle by the age of 3 years. ठीक है. Then square by the age of 4 years, and a triangle by the age of 5 years. Stranger anxiety is seen at the age of 7 months, and child recognizes the mother by the age of 3 months. So these were certain one-liners asked from the social developmental milestones and the motor developmental milestones. Clinical case के form में भी पूछे जा सकते. They will give certain features like the child is able to stand without support and he is saying monosyllables like baba, mama, reiterating या फिर the child is able to undress himself or he is able to make a cube to identify the age. ठीक है, तो ये क्लिनिकल केस के जैसे पूछे जाते हैं. सो दैट्स ऑल इन दिस वीडियो गाइस. तो ये एक शॉर्ट वीडियो थी जिसमें हमने रिपीटेडली पूछे गए 1 लाइनर्स को डिस्कस किया पीडियाट्रिक से. आई होप यू लाइक द वीडियो. Subscribe to my channel, share it with your friends. Thank you guys, bye bye.